My name is James Goodson. I'm the nurse manager of the cardiac cath lab at Hendrick Medical Center. We do left heart caths, we do right and left heart caths, we do electrophysiology studies, we implant pacemakers and ICDs, we do peripheral procedures, we do ecos, which is, we use TPA to infuse into the pulmonary artery to take care of pulmonary embolus. Pretty much anywhere we can put a catheter, we can take a picture and help our patients. We average 15 to 20 procedures a day, 400 a month. Last year we had one of our biggest fiscal years. We increased our volume 20% over fiscal year 2015. So we're busy. I mean, there's something to do every day when you come into the cath lab. There's always going to be a job for you here.
The cath lab is a very tight-knit team, much more so than on a typical nursing floor or even in the ICU. We have the way the cath lab staff is organized, we have nurses and techs who work together and are actually on a called team, and they do all their cases together and get to know one another, actually have a team atmosphere. They rotate and work with different doctors, but the team typically stays intact. As a doctor in the case, you have multiple people that are required in the room. So we have an RN, a nurse who is the circulator in the room. So they administer sedation to help keep the patients comfortable and treat their pain. They also are responsible for pulling the stents and the wires and the catheters that we need during the procedure. We have RNs who scrub the procedures at times along with techs. So they're actually have lead and gowns on, and they're hands-on, actually helping us maneuver stents and catheters and getting them in position. And then we have nurses and techs who learn to drive the x-ray equipment as well as learning to monitor and do all the complicated hemodynamic kind of things that they do in the control room. So there's no way one person can do all those things. You couldn't even do a quarter of those things. And you have to have a good, well-trained team who works together in order to have any success in the cath lab at all.
You can learn a lot here. I mean, not only do you come in as a nurse, but you can circulate, you can monitor, you can scrub in with a physician, you can do electrophysiology studies and learn how to work that equipment. We have tons of supplies and equipment that we use here to treat our patients. So every day is a learning experience in the cath lab. So I think the kind of person that would do well here is somebody who wants to challenge themselves every day.
You have to have a willingness to learn. As I said, working in the cath lab is different from any other unit. So no matter who you are, when you come to the cath lab, you're going to be learning a bunch of new stuff that you haven't seen before and you haven't been exposed to. And that's a good thing, right? It broadens your horizons. And whether you decide you want to stay in the cath lab forever or you're going to go somewhere else, I can promise you when you get done learning what you need to learn in the cath lab, you're going to understand cardiology and taking care of sick people better than you ever thought you would.
The cath lab environment is fast-paced. We have to be efficient to do the amount of procedures we do. We work with physicians and they expect us to be at our best. It's fast-paced, it's challenging. It's really a great environment to work in if you want to be challenged.